Rheumatoid arthritis. Pathophysiology of rheumatoid arthritis. Rheumatoid arthritis, or RA, is a chronic autoimmune which has significant negative impact on the ability to perform daily activities. This is an abnormal immune response where autoreactive T cells become activated, stimulating macrophages and B cells. Pro-inflammatory cytokines, particularly tumor necrosis factor alpha, interleukin-1 and interleukin-6, which perpetuate inflammations within the synovial membranes. Then this inflammatory environment causes synovial cell proliferations and pannus formations, a thickened layer of inflammatory granulation tissues. Pannus then invades and erodes the cartilage and the underlying bones, which leads to joint deformity and functional impairment. And over time, rheumatoid arthritis can also result in systematic manifestations such as fatigue, cardiovascular risk, and osteoporosis. Linking it to the case study, Margaret, a 48-year-old school teacher, experiences prolonged morning stiffness, joint swelling, and difficulty with fine motor tasks like biting and opening jars. Her immune systems are attacking her own joints, which causes pain, stiffness, and functional impairment. Pharmacology of rheumatoid arthritis. Given rheumatoid arthritis autoimmune-driven pathology, the primary treatment goal is to suppress inflammations, slow the progressions of the disease, and preserve joint functions. A commonly prescribed medications, methotrexate, is a classified disease-modifying antirheumatic drug. This is the first-line therapy due to its potent immunomodulatory and anti-inflammatory effects. This medication inhibits the enzyme known as the dihydrofolate reductase, interfering with DNA synthesis in rapidly dividing immune cells. It also suppresses the T cell activations and reduces cytokine productions. As mentioned, typically initiated as a first-line therapy, but for mostly moderate to severe rheumatoid arthritis. And as it slows disease progressions, but also relieves symptoms and improve physical function as well. For nursing considerations, is that routine monitoring of liver enzymes, renal functions, and fluid blood counts to detect adverse effects such as hepatotoxicity, myelosuppressions, and nephrotoxicity. Patients like Margaret should be advised to take folic acid to reduce side effects and to report signs of infection, probably due to the immunosuppressions. Now, this is Margaret, 48-year-old school teacher, as mentioned earlier. The methotrexate can reduce her joint swelling and alleviate her morning stiffness and prevent further joint damage, allowing her to regain some hand functions for daily tasks. This medication affects rapidly dividing cell, as we mentioned earlier, and it requires careful monitoring of bone marrow suppressions, along with the renal impairment and hepatotoxicity as well, as mentioned earlier. To minimize side effects, she should take folic acid supplements, but at the same time also avoid alcohol and adhere to weekly dosing to reduce toxicity risks, since methotrexate is teratogenic, and to women of childbearing age like Margaret, means that they may use effective contraceptions while on these medications. So, in conclusions, rheumatoid arthritis is a progressive autoimmune disease that significantly impacts a patient's physical, emotional, and social well-being. In Margaret's case, her persistence in joint inflammation and pain had disrupted her daily life as well as her professional role as a teacher. And by understanding underlying the pathophysiology is essential for guiding effective treatments, with methotrexate playing as a key role in controlling immune driven inflammations. And of course, holistic care, including pharmacological management, lifestyle adaptation, psychosocial support, are also vital to improving her quality of life and preserving her independence. And early interventions and multi-disciplinary approach can help mitigate long-term complications and empower patients like Margaret to manage their chronic conditions a bit more effectively.